she had spoken with the office prior and spoken to a receptionist, whoever the person was who picked up the phone, and she asked the question, am I okay with continuing to take my diabetes medication, even though I'm not going to be eating anything that morning? And that receptionist said to her, sure. So what happens is that under general legal principles, the doctor is essentially responsible for the actions of those who work in the practice under him or her. So when that receptionist is giving advice, here specifically, take your diabetes medications, even though you haven't had anything to eat and will not have anything to eat for several hours before your appointment, uh, that is giving medical advice. And that's something that should be left to the practitioner themselves rather than delegated to an office staff member. So, from a risk management perspective, I think a thoughtful approach to take is that only the doctor should be giving advice about medical conditions, about medications, about side effects, about potential post-procedure complications. When they do give direct advice, that becomes really problematic. It all falls to the doctor. And the big picture is that the person who is in charge is ultimately responsible for what happens related to the procedure that they are handling, whether it's a question of improper training of office staff so they don't automatically defer to the doctor when it comes up, when they come across something which is not specifically administrative, or it's actually they have been given specifically inaccurate advice, or it wasn't checked up upon, there wasn't an appropriate set of procedures in place for office staff.